So let's talk about something called a septal hematoma. So septal hematoma is the blood which is collected between the perichondrium or the periosteum, right, and the bone itself. Now, it usually occurs due to trauma, or usually occurs due to surgeries, or also occurs during bleeding disorders. What are the clinical features? The person will have a frontal headache because this blood collection would press upon the sinuses, and there will be pressure over the nasal bridge. He'll feel that the nose is heavy, right? It'll literally look like a balloon is there within the nose. Now on examination you will see this soft fluctuant mass, okay, and there will be this swelling which is smooth and rounded. What do you do treatment? See, if it is small, you take a wide bore needle and aspirate it. But if there are larger hematomas, it's best you do a small incision and then take out and drain it. Now the incision is done, small anterior posterior incision is done, which is done to the parallel to the nasal floor, Having said that, after drainage is done, you have to put antibiotics, you have to put systemic antibiotics, and pack it, right? Make sure that any other abscess does not happen. Talking about complications, it might get organized into fibrous tissue and become a thick septum, or there might become a depression, because of necrosis, and there will be septal abscess also, causing the on the nasal dorsum. Now let's talk about the complication, that is the septal abscess. So what is septal abscess? Septal abscess is a infection, or the infection and purulent material collected in and around the septum. Now this could be because of many reasons. It could be septal hematoma, it could be furuncle, or it could be measles and typhoid, right? So this is basically a secondary infection usually. Talking about the clinical features, the person will again have a heaviness or tenderness, so over the bridge of the nose, right? Along with that, he'll complain of fever, chills and headache. Along with that, nose will be red and swollen, right? Now this would be fluctuant on touching. It would be fluctuant and touching, and you could see the swelling. Sometimes it might even undergo spread involving the submandibular lymph nodes. Along with that, right, let's talk about the treatment. See, if because it's an abscess, it's always important we do the incision and drainage. But what is important is that we have to do it at the incision is made at the most dependent part of the abscess, and a piece of septal mucosa is excised. Always remember, the incision must be opened 2 to 3 days to drain any pus which is there, leftover pus is there, or which is being produced. Systemic antibiotics are started, and it is continued for 10 days. Now, what is the problem or complication? Now this abscess may go into perforation or depression, right? Then it will lead to depression of the cartilaginous dorsum. Now how do you repair it? Basically, you do augmentation rhinoplasty, right? Like how you do in saddle nose. So septal perforation is another problem. Meningitis and cavernous sinus are something which is rare, but usually they are a very serious issues. Now talking about the perforation of septum, which is the next complication. So these are basically sequence. One will happen, it will lead to one complication. We'll talk about that complication in detail. That will lead to another complication, which is perforation. Talking about perforation, it could be traumatic. Suppose you're doing a surgery like SMR or doing cauterization of the septum. What will happen? It hole will happen. Or when you're using a galvanic cautery, there will be there will be damage to the septum causing perforation. Sometimes there are people who are having fantasies of wearing these nose rings. They will also perforate their septums. Talking about pathological perforations, we have septal abscesses or nasal myiasis. What is myiasis? Because of maggots or flies, this will happen. Along with the rhinolith, which is stones within the nose. That is pathological. Now, sometimes chronic granulomatous diseases like lupus, that is SLE, then you have leprosy, then you have tuberculosis. One very special thing is that syphilis involves the bone part of it causing perforation, whereas TB, lupus and leprosy causes cartilaginous perforation. After that, midline disorders such as the Wegener's granulomatosis will also involve the total septal destruction. Talking about drugs and cocaines, these people who are using cocaine constantly, or the ones who use like steroidal sprays in asthmas or any disorders. Along with that, people who are doing occupations in these soda ash factories or chromium plating factories, those are again more involved in perforation. Talking about idiopathic, sometimes you don't even know what has happened, like suddenly they could have had this perforation, like nobody knows, like there was a hole. Talking about the clinical features, see, small anterior perforations, when you know breathe in, breathe out, there will be whistling sounds which goes like sui sui, whereas larger perforations, will cause crusts and ultimately lead to bleeding, right? Severe epistaxis will happen if you remove them. Talking about treatment, it is always best for us to know what that granulation is it because of a disorder, is it because of the nose ring, or some infection has happened, so we take a biopsy of it and do checking, like we check for any infective organism. After that, if there are small inactive perforations, what we do is we put plastic flaps, but if they are and to keep the nose crust free, we put these alkaline nasal douches, right, or some blend of ointment. But but the big ones are like they take a lot of too much of extensive repair. But thin silastic buttons can also be put to relieve the symptoms. So in larger perforations, you have to basically keep removing. About DNS, we have to know it is called as deviated nasal septum. What is the main cause? Well, it's because of obstruction. Well, the bigger problem is that it causes obstruction. Talking about etiology, there are two main things. One is the trauma, the other one is errors of development. See, trauma could be of two types. One is the lateral or crushing type. When lateral happens, it affects the Omarian groove or the maxillary crest and displaces the nasal septum. When we're talking about crushing injury, BTF can happen. BTF is buckling, twisting and fractures and duplication. Because of duplication, telescoping of fragments will happen basically. Now, usually these traumas of something happen within childhood only, but people do not take proper history, or even if they take history, they can't get to know, right? After that, now what happens is this will also happen during birth canal injuries. Like if the baby is being taken away through the birth canal, then it might damage the baby's nose and it might cause a lot of damage to the nasal septum. Okay, now so always we should take care during birth also for the nose. Talking about developmental errors, sometimes what happens is the process is like there will be these midline palates, so there will be the growth of palate along the midline. These tectoseptal process will come and join. Now when they are joining, if there is an error, then there will be problem with the nasal septum and the growth of nose, so that will be the developmental error. Now sometimes unequal growth between the base of the skull and the the nasal septum can also be the bigger problem. And sometimes palatine growth or the base of the skull growth will cause a problem. Sometimes in children they'll have adenoid hypertrophy, which will also cause problem with breathe, which will cause mouth breathing, and nasal septum problem will be there. Now it is also important to see for people with cleft lip or palate deformities to check for if they have any nasal septum deviations. Talking about racial factors, white people are more affected than black people. Talking about hereditary factors, it runs in the family. Talking about the types of DNS, the types of DNS are 5 types. One is the anterior dislocation. In this, the nasal septum is completely deviated towards one side, towards one of the nasal chambers. So what happens is one chamber is big whereas the other one is small. Okay, and you can tilt the head to look at it. Talking about C-shaped deformity, here a concavity is produced. Now what happens is this concavity is produced all the way midway between the septum, so it will project into the one of the nasal chambers. So compensatorily the opposite side will have hypertrophy of the turbinates. Then S-shaped deformity will have bilateral obstruction. Done. It can happen vertically or anteroposteriorly. Talking about spurs, between the junction of the cartilage and the bone there is a growth. This spur will press upon the lateral part of the nose, or it will press upon the blood vessels to cause bleeding, or also called as epistaxis, or it will cause headaches. Talking about thickening, that is the last type. Here what happens is there will be overriding of all the fragments, because of which hematoma happens. Talking about clinical features, usually male are affected more than females. Then we are talking about male affected being more affected than females. What happens is it can happen to any age or sex. Talking about the clinical features, so they'll have something called as nasal obstruction. Now this nasal obstruction is very important because the respiratory currents which pass through the upper part of the nasal cavity, therefore high septal deviations cause nasal obstruction more than the lower ones. Now this nasal obstruction can happen unilaterally or bilaterally. They happen in mainly 5 types, that is the vestibular type, the nasal valvular type, the attic type, the turbinal type, or the choanal type, right? So usually the unilateral choanal atresia may be missed in infancy, because you can try to look at it through anterior rhinoscopy but it won't be visible, but when you are looking through posterior rhinoscopy only it is visible. So posterior rhinoscopy or the nasal endoscopy is done. Talking about Cottle test, when we are talking about Cottle test, so what happens is, suppose a person is trying to breathe and air is not going in. During Cottle test, what you do is you pull the cheek towards one side and try to breathe on the same side. When you do that, what happens is, air is, if the air intake improves, that means there is a that means Cottle test is positive. That means the vestibular component of the nasal valve is abnormal, right? Talking about headache, usually the spur is there, no? This spur or DNS, what it will do is it will cause pressing on the lateral valve, which causes pressure headache. Then sinusitis, usually the DNS obstruct the sinus ostia and causes poor ventilation of the sinuses, right? Then you have epistaxis. The spurs will press upon the blood vessel to cause bleeding or this thing. Anosmia, it does not let air to or smell to go to the top part of the nose, which causes anosmia. Then you have external deformity. Like external deformity, like could be anything, cartilaginous, bony involvement, so that the dorsum of the nose is affected, or the tip of the nose is defected, or columella is defected. Middle ear infections, because of no proper ventilation, middle ear infections will happen. Talking about treatment, you can only treat it whenever there is a actual problem. So if the person is having mechanical obstruction or having some symptoms, that is when surgery is indicated. Two main surgeries are there. One is SMR and septoplasty. SMR is called as submucosal resection operation. It is done in adults, okay, done under local anesthesia. It consists of elevating the mucoperichondrial and mucoperiosteal flaps on either sides of the septal framework by a single incision made on one side of the septum, removing the deflected parts of the bony and the cartilaginous septum, and then repositioning the flaps. Okay, so you have to remove things and then reposition the flaps. Talking about septoplasty is done. So it's a conservative approach to the septal surgery, right? In other operations such as septal framework is retained. Only the most deviated parts are removed in this. In septoplasty, only the most deviated parts are removed. Rest of the septal framework is corrected and repositioned by plastic means. So what happens is, mucoperichondrial or periosteal flap is generally raised on only one side of the septum, retaining the attachment and blood supply to the other. So septoplasty has almost now replaced the SMRs. So septoplasty is the most predominant surgery right now, and so that is the thing. Remember, so for people with age of greater than 17 years, septal surgery with conservative skeleton is done, whereas people with 17 years lesser, only conservative septoplasty is done. Talking about enucleation, well, it is defined as the excision of the eyeball. Now it is done under local anesthesia for adults, whereas general anesthesia for children, because they are not controllable. What are the indications? Usually if the eyeball is completely messed up, like if it is having retinoblastoma or if it is having any malignant condition, then it is completely removed. Or it has the worst kind of conditions, like a painful eye with like non-responsive or conservative, like non-responsive to any conservative measures, or like some staphyloma or phthisis bulbi, or suppose there is a cadaver by which you have to take out the eye and you have to do a donation. Then so donation, complete disorder, or like other retinoblastoma, something like that. Talking about the surgical steps, you usually have like somewhere around 6 steps, right? 6 steps. So what are the 6 steps? First step goes to be separation of the conjunctiva and the Tenon's capsule. So the outermost layers, such as the Tenon's capsule and conjunctiva, have to be removed. How are they removed? They are removed by a spring scissor. They are removed by a spring scissor. Use it as a spring scissor. Now what you do is, after that, they both are removed combinedly. They are not removed singly. They are removed combinedly, and they are only removed till the level of equator. They are only removed till the level of equator. And this, what does this maneuver do? This maneuver not just separates the conjunctiva and Tenon's capsule, but it also exposes the extraocular muscles. Now second is the separation of extraocular muscles. So how do you separate them? You hold them with a hook, and then you hold the rectus muscles with a hook, and then you take a silk suture of 3/0 silk suture, and then you tie them, and you do it near the insertion. You put them near the insertion, ultimately taking a scissor and doing a tenotomy. So using a scissor, you do a tenotomy scissors. You ultimately leave a small plump or a small stump of carried suture, a small stump of muscle which is carrying the suture, okay. And what happens with the superior and the inferior oblique is that they are hooked they are hooked and cut near the globe. They are hooked and cut near the globe only. Then what you talk about is the cutting of the optic nerve. Now what you do is, so muscles have come out, outer layers have come out. Now what you do is, you take a speculum, you take a eye speculum and prolapse the eye outwards by stretching it and this thing. Then you pull it outward using those sutures. Then you take a scissor and medially you pass it so that it goes all the way till the posterior part where you feel the optic nerve and you cut the optic nerve. That is the cutting of the optic nerve. Then you have removal of eyeball. Now trying to take out all the adherent tissue which is in and around the place, you holding these muscle stumps with the sutures, you pull out the eyeball. To stop the bleeding, you put a wet pack. Then inserting of an orbital implant. So instead of that, you put a PMMA implant, that is like a polymethyl methyl methyl acrylate or hydroxyapatite implant is put, and like the orbit is sutured, and the muscles are sutured basically. Then you have closure of the conjunctiva and the Tenon's capsule. Now what you do is, the Tenon's capsule is sutured horizontally, whereas vertically you suture the conjunctiva. So conjunctiva is sutured vertically, whereas horizontally you suture the Tenon's capsule using a 6O vicryl. Now the suture is removed almost after 8 to 10 days. You put an antibiotic ointment, and you put like enough pressure pads and what you call bandages. So that is the whole of story of this thing. Then now for that cadaveric eye, you have to put a prosthetic. No, so you put a conformer. Conformer is used to keep the fornices, conjunctival fornices which are retained deep only, and you put all of this. Then you put a prosthetic eye. You put this to kind of cover up the cosmetic appearance. This is usually done after like 6 weeks of healing and of the enucleated chocolate is complete. So after doing the 6 weeks of the whole procedure, then you try to healing and all, then you do this artificial prosthetic eye.